Welcome to TCM Board Formula Series. Today we review Gui Pi Tang, Restore the Spleen Decoction. It belongs to the category Tonife Qi and Blood and Calm the Spirit. The fastest memory hook is this: when spleen Qi cannot make or contain blood, the heart loses nourishment and the Shen becomes restless. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Ren Shen, strongly tonifies spleen and source Qi. Huang Qi, augments Qi and supports containment. Bai Zhu, strengthens spleen transport. Zhi Gan Cao, tonifies Qi and harmonizes. Dang Gui, nourishes heart and liver blood. Long Yan Ro, nourishes blood and calms the spirit. Xuan Zha Ren, nourishes heart yin and settles the Shen. Fu Shen, supports the spleen and calms the spirit. Yuan Zhi, connects heart and kidney and quiets the Shen. Muse Yang, moves Qi so the tonics do not cloy. Sheng Zhang and De Zhao, harmonize and protect the middle. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Ren Shen and Huang Qi. The deputy level is Bai Zhu and Zhi Gan Cao and Dang Gui and Long Yan Ro. The assistants are Xuan Zha Ren and Fu Shen and Yuan Zhi and Muse Yang. The envoy role is Sheng Zhang and De Zhao. Together, the formula tonifies Qi and nourishes blood, strengthens the spleen, calms the spirit and supports containment. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is spleen Qi deficiency with heart blood deficiency and possible failure of Qi to contain blood. Look for this clinical picture: palpitations, insomnia, poor memory, or anxiety. Fatigue, weak voice, poor appetite, or sallow complexion. Easy bruising or chronic bleeding from Qi failing to contain blood. Scanty or irregular menses when blood deficiency is prominent. The tongue is pale. The pulse is thin and weak. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Ba Zhen Tang a Euro general Qi and blood deficiency without the same Shen or bleeding emphasis. Xuan Zha Ren Tang a Euro liver blood and yin deficiency insomnia with more irritability and dryness. Tian Wang Buletin Xin Dan a Euro heart kidney yin deficiency with deficiency heat and a red tongue. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking Qi is the main driver. Safety is part of formula knowledge. Classical cautions include unexplained bleeding, black stool, fainting, chest pain, or progressive weakness requires medical evaluation. Rich tonics may worsen food stagnation, dampness, nausea, or a thick greasy coat. Review pregnancy status and reassess if bloating, rash, bleeding, or palpitations worsen. Modern medication review includes Dang Gui warrants review with anticoagulant and antiplatelet therapy. Huang Qi may require review with immunosuppressants. Zhi Gan Cao adds blood pressure, potassium, cardiac, kidney, diuretic, and corticosteroid considerations. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Heart and spleen pattern. Number 2. Qi and blood deficiency. Number 3. Insomnia with fatigue. Number 4. Failure to contain blood. Number 5. Pale tongue and thin weak pulse. The one-line recall is, when spleen qi cannot make or contain blood, the heart loses nourishment and the Shen becomes restless. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Gui Pi Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.